Welcome to Medical Licentiate Emerson Educational Channel. Epilepsy is a common neurological disorder affecting millions worldwide. It is characterized by recurrent seizures, which are sudden bursts of electrical activity in the brain. Specifically, epilepsy is defined as two or more unprovoked seizures occurring more than 24 hours apart. These seizures can manifest in various ways, from subtle changes in awareness to dramatic convulsions. Antiepileptic drugs, or AEDs, are the cornerstone of epilepsy treatment. These medications aim to control seizures and improve the quality of life for individuals living with epilepsy. Epilepsy affects approximately 1% of the global population, making it one of the most prevalent neurological disorders. While the exact causes of epilepsy are varied, they often involve an imbalance in the brain's electrical activity. This imbalance can be caused by a number of factors, including genetic predisposition, head injury, stroke, brain infections, and brain tumors. In many cases, the exact cause of epilepsy remains unknown. Understanding the underlying cause of epilepsy is crucial for determining the most effective treatment strategy. While AEDs are the primary treatment for epilepsy, other approaches, such as surgery or dietary therapy, may be considered in specific cases. When it comes to understanding the causes of seizures in general, medical professionals often use the mnemonic vitamin D. This handy tool helps categorize the various potential causes into easily remembered groups. V stands for vascular causes, which include conditions like stroke or brain hemorrhage that disrupt normal blood flow to the brain. I is for infection. Brain infections such as meningitis or encephalitis can lead to epilepsy. T stands for trauma, referring to head injuries that can cause lasting damage to brain tissue. A is for autoimmune disorders where the body's immune system mistakenly attacks healthy brain cells. M represents metabolic issues. Conditions like hypoglycemia or other metabolic disorders can trigger seizures. I stands for idiopathic, indicating cases where no specific cause can be identified. And this is where exactly epilepsy falls in. Epilepsy is idiopathic, hence the definition of having two or more unprovoked seizure occurring more than 24 hours apart. EN is for neoplasm, which refers to brain tumors that can disrupt normal brain functions. D stands for drugs. Certain medications or substance abuse can lead to seizures. E represents electrolyte imbalance, where abnormal levels of minerals like sodium or potassium can affect brain activity. Even eclampsia is another E. Lastly, E is for endocrine disorders. Hormonal imbalances, such as those seen in thyroid disorders, can be a contributing factor. By categorizing the causes of epilepsy using the vitamin D mnemonic, healthcare providers can more systematically approach diagnosis and treatment. Understanding these different causes is crucial for tailoring effective treatment plans for individuals living with epilepsy. AEDs work by targeting the underlying mechanisms that lead to seizures. They act on the brain's nerve cells or neurons to suppress the abnormal electrical activity that characterizes seizures. This is primarily achieved through two main mechanisms: modulation of ion channels, and alteration of neurotransmitter activity. Ion channels are proteins embedded in the cell membrane of neurons. They control the flow of charged particles, or ions, in and out of the neuron, which is essential for generating and transmitting electrical signals. Some AEDs work by blocking specific ion channels, such as sodium or calcium channels, thus reducing neuronal excitability and making it more difficult for seizures to occur. Neurotransmitters are chemical messengers that allow neurons to communicate with each other. Some AEDs enhance the activity of inhibitory neurotransmitters such as GABA, which dampen brain activity. Others work by reducing the activity of excitatory neurotransmitters, such as glutamate, which promote neuronal firing. By targeting these different mechanisms, AEDs can effectively suppress seizures in a large proportion of individuals with epilepsy. However, the specific mechanism of action varies depending on the drug. AEDs are classified into different generations and categories based on their chemical structure, mechanism of action, and clinical use. First-generation AEDs, such as phenytoin, carbamazepine, and valproic acid, have been in use for several decades. They are effective in controlling seizures but often have a higher risk of side effects. Second-generation AEDs, such as lamotrigine, levetiracetam, and topiramate, were developed more recently. They generally have a more favorable side effect profile and may be better tolerated, especially for long-term use. Third-generation AEDs are still under development and investigation. These newer drugs aim to provide even greater efficacy and tolerability, potentially targeting specific seizure types or underlying mechanisms with more precision. Choosing the appropriate AED for an individual patient depends on various factors, including seizure type, epilepsy syndrome, potential side effects, and individual patient characteristics. Selecting the most appropriate antiepileptic drug for an individual patient is a complex decision that requires careful consideration of several factors. The type of seizures the person experiences, their overall health, other medications they are taking, and potential side effects all play a role in this decision. The goal is to achieve optimal seizure control with minimal side effects. Common side effects of antiepileptic drugs can range from mild to severe and may vary depending on the specific drug. Some common side effects include dizziness, drowsiness, fatigue, nausea, weight gain, and mood changes. More serious side effects such as liver toxicity, pancreatitis, or blood disorders are less common but require careful monitoring. It is crucial for individuals taking antiepileptic drugs to have regular follow-up appointments with their healthcare provider to monitor for effectiveness and potential side effects. Open communication about any concerns or side effects is essential for ensuring optimal treatment outcomes. Certain patient groups, such as pregnant women, children, and older adults, require special considerations when it comes to AED therapy. AED use during pregnancy requires careful assessment of the risks and benefits for both the mother and the developing fetus. Some AEDs carry a higher risk of birth defects and may need to be adjusted or avoided during pregnancy. Children with epilepsy may have different treatment needs than adults, as their brains are still developing. The choice of AEDs for children must consider their age, seizure type, and potential impact on cognitive development. In older adults, age-related changes in metabolism and organ function may influence AED selection and dosage. Polypharmacy, the use of multiple medications, is also a concern in this population as it can increase the risk of drug interactions and side effects. Addressing the unique needs of these special populations requires a multidisciplinary approach involving neurologists, pharmacists, and other healthcare professionals with expertise in epilepsy care. While primarily used to treat epilepsy, AEDs have also shown efficacy in treating certain psychiatric conditions. This is because the mechanisms that underlie seizures, such as imbalances in neurotransmitters and neuronal excitability, are also implicated in several psychiatric disorders. For example, some AEDs, such as lamotrigine and valproic acid, are used as mood stabilizers in bipolar disorder. They can help to prevent both manic and depressive episodes, improving mood stability and overall quality of life. Certain AEDs have also shown promise in treating anxiety disorders, such as generalized anxiety disorder and social anxiety disorder. Their calming effect on the brain's electrical activity may help to reduce anxiety symptoms and improve coping mechanisms. The use of AEDs in psychiatry highlights the complex interplay between neurology and mental health. It also demonstrates the versatility of these medications in addressing a broader range of neurological and psychiatric conditions. The field of epilepsy treatment is constantly evolving, with ongoing research aimed at developing more effective, safer, and targeted therapies. Scientists are exploring new drug targets, delivery methods, and treatment approaches to improve the lives of individuals with epilepsy. One area of active research is the development of precision medicine approaches for epilepsy. This involves identifying specific genetic or biological markers that can predict an individual's response to different AEDs. Another promising area is the development of non-pharmacological treatments for epilepsy. This includes devices that can detect and interrupt seizures, as well as neurostimulation techniques that modulate brain activity to prevent seizures. These research efforts hold great promise for the future of epilepsy treatment, offering hope for more personalized and effective therapies with fewer side effects. Antiepileptic drugs are essential medications for managing epilepsy and improving the quality of life for millions of individuals worldwide. By targeting the underlying mechanisms of seizures, these drugs can effectively reduce seizure frequency and severity, allowing individuals with epilepsy to live fuller, more independent lives. The field of epilepsy treatment continues to advance, with ongoing research and development of new and innovative therapies. As our understanding of epilepsy grows, so too will our ability to provide more targeted and effective treatments for this complex neurological disorder. Thank you for watching the Medical Licentiate Emerson Educational Channel. Please subscribe and like this video.